Kettering is part of a group with Northampton General Hospital, and recently published our digital strategy. And in that strategy, we have an ambition to be the most digitally enabled hospital group in the country by 2023.
It will probably change the landscape physically of how the hospital's laid out, and we're kind of keen to free up any space that we can for clinical use.
So in the very first instance, we looked at all of our roadmap to see what impact that would make positively for what we could enable staff to do during the pandemic with technology. And actually we found quite a lot of what we'd had got planned would really support it. I've been a qualified nurse for 26 years, and my immediate emotional reaction was to go and put on my uniform and go and help on the front line. It really made me feel extremely guilty. But then when we started to deploy the technology, that just went away, because the stuff that we were putting in, the applications, the way that I was able to support staff in using them, far outweighed anything I could have done as an individual.
Phoenix are working with Kettering General Hospital to help them completely transform their IT estate. That includes getting everything off premises and into the cloud. It includes helping them with a data warehouse for their health intelligence team, and also helping them to develop new ways of virtual working using the Microsoft 365 suite and Surface devices.
We've invested heavily in the past on-premise data centres. What we want to be doing is focusing more on doing more innovative things, and actually the cloud kind of enables that, because rather than having to focus on being very capital heavy in terms of investment, we're moving to more a consumption model.
Where they're coming from is really a place of legacy infrastructure. They need to completely modernise their data centre and really unlock the power and capability that the cloud is going to provide.
Moving to the cloud is a key component of our digital strategy. We published a cloud-first strategy in 2020, and I believe we're the first trust to do so.
We knew we needed to scale going forward as we bring in new services, tear down old, spin up some rapid solutions. We needed to scale.
I am very interested in digital inclusion and inequalities. Cloud opens up all of those possibilities.
As trusts move to the cloud, whether it's in its entirety or as a hybrid strategy, they'll be able to access functionality such as artificial intelligence, machine learning, as well as the Internet of Things. All of these new exciting areas are leading edge.
As we move forward, we're looking at how we can make best use of the resources that we have, and also around the technologies that we're using.
What Microsoft are providing is access to resources and their Azure Fast Track team, and they're also offering training and skilling through the Enterprise Skills Initiative.
So we're now starting to dip our toe into the discovery of Windows Virtual Desktop to see what that can do for us as a trust.
And working closely with Microsoft and Phoenix is enabling them to move at a really fast pace, whilst ensuring they deliver this change in a secure and, importantly, sustainable manner.
Ultimately, we're doing all of this for patients. As we grow our skills and our people, that will be putting people focused on what they need to best, so we can have more time to support patients.
Knowing that the work we're doing with Kettering General Hospital and many other NHS trusts is having such a huge impact is something I take huge pride in, because it's that acknowledgement, the support that those patients are going to get has been enhanced through the technology advances that Microsoft, Phoenix and other complementary technologies are making in these hospitals and in these trusts.